Hello and welcome everyone to HSI Paragraph Point. If you are preparing any of these exams, then this is your go-to spot for focused and free exam preparation, where you can get 365 days free test series and daily question practice. To know more, join our Telegram channel. Link is in the description box. So here we start our first question. So the first question is permanent hardness of water is caused by. So, what is permanent hardness? Permanent hardness is due to calcium and magnesium sulfate, which cannot be removed by boiling. So, the correct answer is calcium sulfate. It is insoluble in boiling and responsible for the permanent hardness of water. Talking about the other options, so NaCl is also known as common salt. It is responsible for the salinity of water, not for hardness of water. KCO means potassium carbonate. It is soluble alkali, not responsible for the hardness of water. And magnesium carbonate, it is responsible for the temporary hardness of water. Our next question is, which of the following is an occupational disease? So what is occupational disease? So occupational disease occurs due to prolonged exposure at workplace. So anthracosis is the occupational disease. It is caused by inhalation of coal dust. It is also called black lung disease. And while talking about the other options, so pneumonia and tuberculosis, these two are bacterial disease. It is not occupational disease. Next question is, which organism is the source of Japanese encephalitis? So J is zoonotic viral disease transmitted by Culex mosquito. Pig are the amplifying host and the source of the JE, while mosquito is the vector of J. Rat and the cow, these are not related to J. Next question is, oral polio vaccine in the children is example of. So it is the example of primary prevention. What is primary prevention? It is preventing disease before the occurrence by vaccination. So OPV is given to prevent polio before the infections comes. Talking about the other option, so primordial prevention. So primordial prevention prevent development of risk factor, and secondary prevention is early diagnosis and treatment, and the tertiary prevention is rehabilitation. So the correct answer is primary prevention. Next question is, typhus spread through. Typhus is spread through loose. Typhus is caused by Rickettsia species transmitted by lice. So the correct answer is head loose. It is responsible for the typhus. Groon is irrelevant to the question. So correct answer is head loose. Next question is, which antipyretic is contraindicated in neonates? So what is neonates? Neonates is infant which is less than 28 days. So the correct answer is amytal salicylate acid. It is also known as aspirin. Aspirin may cause Rhine syndrome in neonates. Paracetamol and ibuprofen, these are safe to the infant. So our next question is, percentage of formaldehyde in water. So formalin contain 40% in formaldehyde. Formalin commonly used for preserving a specimen and disinfection. So as you can see, there is no option available for 40%. So near option is 20%. Formalin is 40% of formaldehyde gas in water. So we can consider 20% because the other option is too low for the formalin percentage. Next question is, In a test, the reaction considered positive when. So positive chemical reaction indicate a visible change like color change and precipitate etc. So the correct option is color change. Smell emitted and smoke, these are not the positive reactions. Next question is, vaccine carrier can maintain temperature if it is not open. So the correct answer is 24 hours. Vaccine carrier with ice packs maintain temperature from plus 2 degrees Celsius to plus 8 degrees Celsius for 24 hours when it is unopened. When we open frequently, temperature fluctuate. So the correct answer is 24 hours. Next question is, which of the following is not symptom of AIDS related complication? So talking about the AIDS related complications, chronic diarrhea, weight loss, fever and night sweat. So mysterious diarrhea lasting more than a month, it is a symptom of AIDS. TB, TB is secondary infection, and weight loss more than 10%, it is also symptom of AIDS. And fever and night sweat, this is the also symptom of AIDS. So the correct answer is TB. Hence it is not a symptom but but an associate disease with the AIDS. So the correct answer is TB. Next question is, which of the following is an immunity response for problem faced by a person? So the talking about the talking about the rationalization, projection and compensation, these are the defense mechanism, while the despair is an emotion, not an defense process. So it is not physiological defense. So the correct answer is despair. Next question is, which of the following is not an essential amino acid? So the correct answer is serine. Leucine and tryptophan and histidine, these are the essential amino acids. Next question is, xerophthalmia is caused by the deficiency of which vitamin? So, correct answer is vitamin A. Xerophthalmia, it is also known as dry eye. It is caused by deficiency of vitamin A. While talking about the other option, vitamin D, the deficiency of vitamin D cause rickets, and deficiency of vitamin E cause sterility, and deficiency of vitamin K cause bleeding. So our next question is, in Gomes classification, mild malnutrition is when the weight is between percent of normal body weight. So talking about Gomes classification, 90% is considered normal and 75 to 89% consider mild comes under grade 1 category, and 60 to 70% is considered moderate comes under second grade category, and less than 60% is considered severe comes under grade 3 category. So the correct answer is 75 to 89%. Next, mid upper arm circumference is considered normal if it is more than. So talking about mid upper arm circumference, so the range is less than 12.5 centimeter is comes under nutrition, and range between 12.5 to 13.5 comes under borderline, and greater than 13.5% consider normal nutrition. So the normal nutrition, the correct answer is 13.5 centimeter. Next question is, which vaccine is given at 5 years of age? So the correct answer is OPV X dose. According to National Immunization Schedule, 5th year child is given DT and OPV booster. MMR is given at 15 to 18 month. TT is given to 10 and 16 year. So the correct answer is OPV booster. Next question, medical college level health facility is, so starting from the first option, primary comes under PHC and subcenter. Secondary comes under CHC and district hospital. Tertiary comes under medical college and specialized hospital. Quaternary comes under advanced research center. So the correct answer is tertiary level. Next question is, maternal mortality rate relates to death during pregnancy up to how many weeks? So MMR, maternal mortality rate, include death up to 6 weeks or 42 days. According to WHO, death of a woman during pregnancy or within 42 days, 66th week after the termination, consider MMR. So the correct answer is 5 to 6 weeks. Next question is, correct method to calculate delivery. So it is calculated by Nichols formula, where estimated delivery date, which is EDD, and first day of last menstrual period plus 9 months plus 7 days, it is used for regular 28 days cycle. Next question. Our next question is, all are true about the ideal IUD user except. So the correct answer is no children, normal menstrual cycle, no pelvic infection, and access to health facilities. These are the ideal user of IUD. Next question is, our next question is, postcoital contraceptive is done by which of the following? So the correct answer is levonorgestrel. Levonorgestrel, it is an emergency contraceptive pill taken within 72 hours after unprotected sex. It is also known as morning pills, and it inhibits ovulation and fertilization. Some examples are I-pill and unwanted 72. Next question is, biological element of sewage can be estimated. Talking about the BOD, BOD means biological oxygen demand. It is measure the amount of oxygen required by microorganisms to decompose organic matter and water. So high BOD leads high organic pollution. A standard test done at 20 degree for 5 days. For safe water, BOD should be 0. So the correct answer is EOD. Next question is, the place of the screen in the sewage system. So the screen is placed at the junction to remove the large floating material like rags, wood and paper. It prevents blockage in treatment plants. So the correct answer is where the domestic sewer meets the public sewer. Next question is, the latrine used in sewerless areas for accessible toilets. So the correct answer is pit latrine. Pit latrine because they are simple and suitable for rural area without sewer lines. It is economical and required less water. Should be placed at least 15 meters away from the water sources. So the correct answer is pit latrine. Next question is, minimum detention period to be provided by a septic tank is. So the correct option is 24 to 48 hours because the time required for settling and anaerobic digestion of the sludge. Next question is, as you can see, the question is in the Hindi language, so we can also, the correct answer is 1 year. 1 year because periodic cloning and prevent clogging and odor formation. Next question is, biological oxygen demand is calculated as. So the correct answer is oxygen consumed in ml per sample in liter at 37 in 24 hours. Next question is, the disinfection used for blood shimmer and lab contamination. So the correct answer is 1% sodium hypochlorite. It is commonly used for surface disinfection for biological spill. Chlorine based effective against virus and bacteria. Contact time should be 10 to 30 minutes. Next question is, the color code for disposal of biomedical waste containing sharp items like needle and scalpels. So the correct answer is white transparent. Sharp waste like blade and scalpel should be disposed into white puncture proof container after disinfection. Next question is, disposal of biomedical waste with yellow color coded should be done. So the correct answer is incineration. Incineration because yellow bag contain anatomical, pathological and soiled waste. The incineration should be greater than 800 degree Celsius to destroy the pathogens. So our next question is, which among the following is not an element of IVC for malaria? So the correct answer is prophylactic chloroquine. IVC is integrated vector control, not prophylactic, not chemoprophylactic. So the correct answer is prophylactic chloroquine. Next question is, which mosquito bites during daytime? So the correct answer is Aedes. Aedes aegypti bites at daytime and it spread dengue, chikungunya and Zika virus. They breed in only in clean and stagnant water and also known as man-made mosquito. So our next question is, mosquito usually lays egg in stagnant water with aquatic plant like pistachia and icornia. Such water bodies are suitable breeding for. So the correct answer is Ansomnia. These mosquitoes lay eggs in stagnant water and aquatic plant. So it is controlled by surface drainage, such as water should be drained through the surface drain to remove the floating vegetation and prevent mosquito breeding. Next question is, effective control for stagnant water in pots, old tire, jars and coconut shell. So the correct answer is Aedes, because these are common breeding sites for Aedes mosquito. For prevention, empty the container weekly. Which vaccine is given by intradermal route? So the correct answer is BCG. It is given intradermally. Next question is, in which of the following does the numerator always include the denominator? So the correct answer is proportion. In proportion, numerator is the part of denominator. Example, infant death upon total life birth. So the correct answer is proportion. Next question is, The stage from full dilatation to the birth of the baby is called, so it is called second stage of labor. Second stage of labor is full cervical dilatation, which is 10 centimeter at the birth of the baby. Next question is low birth weight LBW babies birth weight is less than how many grams? So less than 25 gram is considered low birth weight. Irrespective of gestation age, it causes prematurity. So the correct answer is 25 grams. Among the following is not one of the big three deadly childhood disease. So the correct answer is protein calorie malnutrition. Talking about the other option, diarrhea, poliomyelitis and pneumonia. These considered big three deadly childhood disease. Next question is, in child growth chart used in India, third degree malnutrition is indicated by the fate of children below. So the correct answer is 60%. Our next question is, copper tea is a dash generation disease. So the correct answer is second generation, where copper tea and Cu7 is considered second generation IUD. IUD means intrauterine device. So talking about other option, so first generation is lips, loops, and the third generation is hormonal IUD, which is LNG20. Next question is, which of the following is not a measure of variation? So the correct answer is Rocky Mountain Spotted Fever. It comes under the disease. Paris green is effective against the larva. The correct answer is Anopheles. Anopheles Paris green is a larvicide for malaria control. Next question is, if a mosquito rests at an angle with the wall, its species is. So the correct answer is Anopheles. Anopheles rest at the 45 degree, while Culex and Aedes rest at the parallel to the wall. Next question is, the infection spread by sandfly is. So the correct answer is Kala Asar. It is also called as Leishmaniasis. Next question is, which of the following is a disinfectant? So the correct answer is barium carbonate. Barium carbonate, it is also used to kill rats and mice. Next question is, compare to category 1 and category 2. The additional drug is used in the treatment of category 2 tuberculosis. So the correct answer is streptomycin. Streptomycin is additionally added to category 2 tuberculosis patient. Next question is, parapsychosis is related to. So it is the correct answer is progressive hearing loss. Progressive hearing loss with age. It is age-related deafness due to cochlear degradation. Next question is, the next question is, organism referred for fecal oral infection is. So the correct answer is Trichinella spiralis. Next question is, pig meat tapeworm is. So the correct answer is Tinea solium. Here we completed our 50 questions from PYQ. Follow for more upcoming videos and detailed answer PDF available in the Telegram channel, where you can also get free test series for upcoming exam. Thanks for watching.